The best part of my job is to, unfortunately, be connected to these families because of what they've gone through, but fortunately bring their thoughts and passion to life and respect and honor their loved ones and still continue to do good.
Welcome to StaffBuffalo's Pain Points Podcast.
Hi, welcome to another episode of the Pain Points Podcast. I'm Lauren Lewis, and I'm here with Christina Pearl, Corporate Director of Communications at Horizon. Chrissy, thank you so much for joining us.
Thank you for having me.
I love your story about your career and the work you do at Horizon, and you just are such a bright light in this community.
Thank you. I feel the same about you.
Oh, thank you. So I'm so happy to have you share your story with us and the Pain Points Podcast and kind of talk about your career and the work you do at Horizon.
Perfect.
So please feel free to start sharing your story with us.
Thank you so much. It's an honor to be here. I love your podcast.
Thanks.
So grateful to be a part of it. And yes, I've been at Horizon for 15 years.
Awesome.
It's been amazing. And our organization focuses on mental health and substance use treatment and resources throughout Western New York.
Amazing.
So we have outpatient counseling services, inpatient and residential services, family services, and we have individual, group, family counseling. And
many amazing resources for the community.
And so needed, you know, for so many different people, so many different walks of life. So my journey at Horizon started actually about 17 years ago. When I first moved back to Buffalo after college, I didn't really know what I wanted to do. I had gone to school for business and marketing, but there really weren't marketing jobs. So I took a job with a for-profit corporation doing loan processing, and I went back to school for my master's in organizational leadership. And
I love that.
Through that, I really wanted to get more involved in nonprofit work.
Yeah.
I'd always loved volunteering. I'd always loved giving back to the community in one way or another. And so I thought, why don't I just start looking for opportunities? And since I didn't really know anybody when I moved back, I started just joining committees and networking. And I found that there were a lot of nonprofits out there that needed, you know, people on their boards or needed people to sit on committees. And I was like, well, that's a great way to learn.
Absolutely.
Because I don't know what I don't know.
Right.
So Ann Constantino, who was the CEO at the time, had reached out to me and said, I know you're back in Buffalo, and we're actually looking for younger people to join our board. That was for Horizon back in the time of the opioid epidemic when young people were kind of just getting started to experiment with opioids and it was really starting to become an epidemic. So she's like, I really want a young visual mind on our board, represented. So I never served on a board, but I went through, the board orientation with Ann and Aaron DiGirolamo, who's now our CEO, and I loved it. I was so excited to sit on the board and learn a lot about their mission. So I was on the board for about a year and a half, and Erin approached me. She was the CFO at the time, and she said, I know you didn't go to school for finance, but we have a position in the accounts payable department. And I was like, okay, I'll apply and give it a shot.
I love that.
And so I applied, but throughout the application process, I did propose a marketing position at Horizon. I noticed they hadn't had one. They had used some consultants, but they were growing. At the time, they were 200 employees. Now we're 900.
Oh my gosh. Wow.
And I just knew that you were going to need somebody. I was asking senior staff, who's doing your communications? Who's doing your PR? Who's doing, your events or your
outreach? Yeah,
exactly. And they were like, well, we are. And I was like, well, you're so busy, running a company. Let me help.
Yeah.
So they loved the proposal. I put together a proposal, but it just wasn't the right time for them to add it in. So I accepted the accounts payable job after the interview process, after getting offered it. And I said, I'll learn a ton about the back end of the company. And, we'll go from there. So about a year and a half into the accounts payable role, Ann and Aaron approached me and said, we're ready to add a marketing position to Horizon.
Yay.
So that was in 2012. I started at Horizon in 2010, joined the board in 2008. And so I've just been growing there ever since and really grateful for the leadership there because they took a chance on me.
Absolutely.
I didn't have marketing or PR experience outside of schooling and sitting on committees. So they really took a chance on letting me create this department and like work closely with all the teams.
Yeah.
So yeah, now I was a department of 1 and now I'm a department of 4.
That's awesome. You have to build your own team too, which is amazing.
It's been amazing, and I just really think it says so much to like the culture of an organization when they can, you know, take feedback and take ideas and put it into place, and then you just grow as the organization grows.
And I think a lot of organizations, I mean, 200 people is a lot. That's a big organization.
Yes.
And so I'm sure they've encountered a lot of the growing pains from 1 to 200.
Absolutely.
Right? You need good people that fit your mission, fit your organization, fit your culture, but also that figure out mentality. And 2 things you told me, you were like, I really didn't know what I wanted to do after college. I was kind of finding my way. So I thought joining a board would be great.
Right.
And I tell people that all the time when they're job searching or they're looking maybe career transition, join a board.
Yes.
Join a committee. And maybe join, if you're on a board, you don't know anything about finance, join the finance committee on that board to learn and start building your skill set in that area.
You're so
and
right.
it opens up other doors for you too. So
it does.
You have that mentality of just like, I'm going to dive in and figure it out.
Yes.
It goes so far.
It really does.
Help you in your journey, but also helps your organization too.
Totally.
I think a lot of organizations really can benefit from someone who's a good culture fit, right?
Yes.
And has that figured out mentality like you did.
Yes.
And seeing maybe holes in the organization and where you can help them grow.
Yes.
So, hey, I see what you're doing with marketing, but like, that's not that person's job. It's not this person's job.
Right.
They're busy with X, Y, and Z.
Exactly.
And if we're continuing to grow as an organization, I want to help do the marketing.
Absolutely.
And
absolutely.
Outreach and communication.
Yes. And it's so important to really sit back and, you know, look at what is working, what's not. And also, like, what can we take off people's plates to work, like, smarter, right? Mm-hmm. And I think with our department, you know, when I first started, when I first proposed the position, I was like, I want 9 out of 10 people to know, like, who Verizon is when I walk into a coffee shop.
Yes.
And so it was, like, that external feel. But then as we started growing, as I started getting into my role, I realized we're growing as an organization. The internal communication, the internal culture, like, there are brand ambassadors. When you're at an organization, you need to believe in the mission and the values, whether it's corporate or nonprofit, right? So I wanted to make sure our teams were informed. Yeah. They could trust us. They knew what was going on. They were the first to hear about it. And then that way we can tell the community. But if our people don't know, then how is our community? Why would our community find out first?
They're not going to be the ambassador in the community.
Exactly.
They need them to be.
Exactly. Yeah. So it just allowed me to take more time to look at, you know, what can we do to really be like a best place to work and a best place to receive care? And I think that goes not just for Verizon, but for any organization, like looking at what you can do for your people. And then from there, it just trickles down to like what we can then do for the community.
And especially the aspects of the community that you're touching and impacting and making a difference in. You need the people to kind of be those ambassadors.
Totally.
There's people who maybe are silently dealing with things that they need help with and they need support with, and they don't even know who to call or who to talk to. But
absolutely.
If you have some connections in the community, Horizon's going to be, it's like a Xerox.
Exactly.
You know, Horizon might be your first phone call then. And you guys do an amazing job in the community spreading awareness about what Horizon does and the support you provide and resources you provide. I feel like you've done an amazing job.
Thank you.
Building that brand.
Yes.
And having it out in the community.
Thank you.
Because I see it everywhere.
I'm glad. Mm-hmm. And I think, too, we're normalizing the conversation, right? I get phone calls, I get emails, I get texts every day from people in the community. Hey, Chrissy, I have a question. Yeah. Hey, my family member is struggling with something, or a friend of a friend. And even though I'm not on the clinical side, I'm so passionate about just connecting, right? Connecting where people need it the most. Absolutely. And if they feel comfortable. And so if I can do one thing by normalizing the conversation on outreach and being that organization that people feel comfortable calling, because it's hard to pick up the phone. It's hard to admit when you're struggling or when a family member is struggling. And so I just think that connection is so critical. And if people feel that comfort level and if they feel that support or see it in the community, then hopefully they'll dive in.
I texted you one day. One of the boards I sat on, there was an incident at the organization, and they wanted support for the employees who experienced this, but the incident happened to be. And so I was like, well, who do I call? And I was like, oh my gosh, I'm reaching out to Chrissy.
Yes.
And I was like, if Chrissy and Horizon don't know how to help our organization, then probably not the right person to direct us to.
Sure, absolutely.
But I connected you with our executive director, and I think it turned into like something, a training for our staff at this organization. So it was amazing. It's an amazing resource to have.
Great.
Just knowing someone that you can be like, let me reach out to you.
Yes.
And find out.
And I so appreciate that. And I always look at it as like collaboration is key.
Yeah.
Like we work so much with other providers in Western New York. Mm-hmm. And unfortunately there's enough work to go around right now, right? Mm-hmm. But also like we're better when we collaborate. We're stronger when we come together and look at the needs. And you're right. Like if we couldn't figure it out, we would find somebody to figure it out.
I'm like, at least I could, like, they can at least put us in the right direction.
100%. Yeah. It's a starting point. And just those are the connections that make me feel so grateful for our community. Just knowing like I can reach out and I can ask a question and I feel comfortable asking it, and then we'll go from there.
And you have an amazing team of clinicians at Horizon. And I've been able to experience one of your gems, I think, in leading a training for Buffalo Niagara Human Resources Association, which you've always been a great partner to BNHRA.
Yes, we love it.
For helping HR professionals navigate, employee issues in the workplace.
Yes.
And I think that's an amazing opportunity, and a great thing that Horizon does is provide that training to HR professionals, to employers. I think all employees should have some sort of training and awareness, because that's only going to help us all help each other.
Absolutely. And we really focus on that. And you really helped us a couple of years ago get into that space. So we were so grateful for that, because I think employers don't know what to do. They don't know what to say. And burnout's real, right? There's a lot going on no matter what organization you're in and who you're serving. And so we do community outreach. We do trainings. We do awareness. We do resource trainings. Mental health 101, stress management and emotional wellness. We have ad hoc EAP programs for organizations.
Awesome.
We can do on-site counseling. But
there's so much.
There's so much need, and we have a menu of items, but also just knowing that people can get educated. Yes. We can come in and just talk about, what does depression look like?
Yeah.
What does anxiety look like? How to have a conversation with your employee or your colleague. Yep. Signs and symptoms. Just things that help you both personally and professionally.
Absolutely. I mean, who doesn't need help with stress? Reduction techniques.
Exactly. Coping skills. Yes.
Meditation, or just kind of like, okay, I'm going to close my eyes, I'm going to visualize.
Exactly.
It's personal. We're all going to do certain stuff.
Yes. And it's so helpful.
Personally, professionally. So it's, having those resources available is amazing.
Yes, it really.
And I think, like you said, the connection is huge, because we're people.
Yes.
And you want that person-to-person connection and interaction. And that helps.
It does.
Just build relationships, build support, and just know that someone else is out there, like, to be there to help you.
Absolutely.
To guide you.
Absolutely.
Yeah. One of the things I wanted to, bring up too is we talk about employers and in the workspace, dealing with your employees. Sometimes I think employers or supervisors, managers, maybe they sense something with other employees, but they also they want to pry.
Yes.
Maybe the person wants things confidential. So it's like, how do you approach those things? So having trainings available to help people navigate just conversations and have conversation starter without prying too much is super helpful too.
Yes. And I think that that's something that a lot of people struggle with, both in the workplace and then even at home.
Yeah.
Right? So you are nervous to kind of talk to a colleague or an employee or a supervisor about something you're recognizing. At home, you might be nervous to talk to your spouse or partner or son or daughter. And we have a number of trainings that really just talk about how to have those conversations, what resources you can provide, what you can say, and also like what you can just put in front of people and present, and create a culture around resources and help and asking for help. And again, going back to that normalizing conversation, because I think it is hard. I know when I first started at Horizon, we, opened a new location and we sent out postcards about our new location opening. And I got a lot of complaints when people received that in their mailbox.
Really?
Because they were very nervous that other people would see a postcard in their mailbox saying, oh, Horizon's in your neighborhood. I don't need help. I'm okay. Nothing's wrong.
Right.
But that was the stigma. And it's still there, but we're really trying to break down that stigma. I think we've done a great job as a community, as a country. I think there's so much work to do, but we're all collectively doing it by having these conversations, by going out to organizations, doing those presentations, and just making people feel a little bit more comfortable understanding mental health, understanding substance use, and knowing that there's help.
Right.
Like, you're not alone.
Right.
There's help. It's why we're in business. It's why we've been in business for 50 years.
Wow.
And there's help there in whatever avenue you need it. And if we can't do it, we'll find somebody that will.
I didn't realize Horizon has been in business for 50 years.
Yes, it's our 50th year.
What a great milestone.
I know.
And Anne founded the company.
So actually, we had a previous CEO that founded the company. Yes.
Okay, awesome.
So he founded the company. It was actually initially part of the county. We broke away from the county, and then he took Horizon and started it. Unfortunately, he passed away at a very young age, at 47, and at that point, the board appointed Anne.
Okay.
And then it was in 1994 when Anne took over. And we had actually just opened Horizon Village in 1994. So Horizon Village is out in Sanborn, New York. It was the first residential treatment facility in Western New York.
Really?
So it was a 50-bed facility, and now we have 125 beds out on the campus. But so Anne took it over in 1994, and we just celebrated our 50th year.
That's amazing.
And Anne retired a couple of years ago. Erin DiGirolamo is now our CEO, and we are looking forward to the future because we want to still be that pillar of support and hope for the community. We want to work with our provider partners. We want to work with our referral teams. We want to work with our community. And we want to keep serving, whatever that looks like. You know, we're meeting people where they're at. We started telecounseling right before COVID hit. Thank goodness.
Thank goodness.
Right?
Yeah.
And
timing on that part.
Yes. And we're just figuring out what people need, and it's changing. We have a children's program that we started about 6 years ago. Going on 7 years, we treat children ages 3 and up for mental health. And for substance use, we treat adolescents too. So the community need is there, and we're just trying to meet everybody where they're at by that person-centered care.
So being around 50 years as an organization, I'm sure it's grown, it's changed, it's adapted to the needs of the people in our community. In your 17 years, we'll say, since you've been on the board and then started full-time with Horizon, what were some of the biggest changes you've seen in the space that Horizon is in the mental health space, behavioral health, addiction?
I think from when I started to where we are now, people are more open to talking about it. People are more understanding of that can't happen to my family. They know it can, but I think they're also understanding that you don't just have to be in crisis to reach out. Right?
Yeah.
If you're not feeling well, if you're struggling, if you're a new mom, if you're right out of college and struggling with the next step in your career.
The anxiety behind that.
Yes.
I still remember that time.
Yes.
It was stressful.
Yes.
And there's a lot of pressure that gets put on young adults. And
there
students
is.
To find their career.
Yes. There is so much pressure. So I think now people being more understanding to it's okay to get help.
Yeah.
We're in over 30 schools in Western New York. We have satellite locations in elementary, middle, and high schools, and some colleges, because that helps break barriers of transportation, logistics of getting someone to treatment. So that's also normalizing it. We have elementary school students, middle school students, and high school students that now can see their counselor during a free period during school. Yeah. And their parents sign off on it. But we work closely with the schools to establish this additional support because the schools have incredible counselors on staff.
Of course.
And we're just brought in for that additional support.
Extra support.
Right.
Resource.
Right. Mm-hmm. And I think that's been so amazing to see to our collaboration with the schools.
Yeah, that's a game changer.
It is. Our collaborations with other community partners just coming together for, continued outreach, enhanced programming, and just grant opportunities, partnering with other community partners and agencies on grant opportunities, like servicing the need, coming together. All right, you can service that. All right, we're going to service this.
So an organization might come to you because they have a grant.
Yes.
For mental health.
Yes.
And wellness. And then they can come to Horizon and say, hey, we have X amount of dollars. Here's kind of what our thoughts are, maybe what we need in our organization. How can you help us? And
Sure.
you can develop a specific plan.
Yes. And a lot of times, depending on the grant and depending what, the grant is establishing, like they like to see community partners coming together because we might not provide a certain service, but somebody else might provide a certain service. And then we come together and we can provide that, a continuum of services that might not be available.
Yeah.
So I just think it's been so nice to see our community coming together more,
Absolutely.
working together more, and we're all working towards stronger community partners and better mental health, right? Better resources for substance use, advocacy. So when you're collaborating with other organizations, it's so much better because your voices are stronger.
Absolutely. And we had a guest on the podcast recently as well, and she was talking about her time in corporate America.
Yes.
And there were people on her team that struggled with different addictions.
Totally.
And that was a very large private company in the U.S. and they would pay for treatment for some of their employees, which is amazing.
It's amazing.
But it's important and I'm not saying every company has to fund it.
Sure.
Right? But at least provide resources for employees.
Absolutely.
And know that there are options out there.
Absolutely. And I think many years ago, I worked on a campaign with Blue Cross, and I work now, obviously. It was a painkillers kill campaign. Mm-hmm. And it was right when painkillers were just really taking over, and it was an epidemic. And it was the first time we all really started talking about it. And we put faces with the campaign, and, Blue Cross headed it, and it was a huge campaign. It was nationally recognized, but it was because it was one of the first that really took on the uncomfortable conversation, right? And the scary conversation about substance use and battling addiction and what that looks like, but really pushing out education to doctors, education to our community and families, Narcan training, things like that.
Right.
So through these campaigns, as emotional as they can be, right? Because you're touching on really difficult conversations and topics. It's those conversations that, really resonate with family members, with loved ones, because they're like, okay, I know I have a place I can go. Right. We have treatment. We have inpatient treatment. We have residential treatment. We have outpatient treatment. We have treatment options that could work for you. But now you know where to go, right? Or you know maybe what to look for, so you're not calling us just in crisis.
Is there a specific campaign that you worked on that was your, I don't want to say favorite might not be the right word because of what we're dealing with, right? But then maybe you felt the most impact on?
Yes, I would say Painkillers Kill was incredible just because it really shed light on what the work we needed to do as a community and how we were all able to come together. That was really incredible. That was in 2013. So it was a long time ago.
But that also was kind of right around the time you were just starting your marketing role. So that's a huge impact.
It was.
From the get-go.
It really was. It was a great learning experience. I learned from a lot of incredible marketing agencies and marketing teams. But I think every campaign we've worked on at Horizon, whether it's, perinatal mental health or children and adolescent services or pushing out information on new services, it's always so impactful because you sit back and you look at how many people maybe didn't know what was available and now they do, which is so satisfying. But also you're just so proud to know that we can help and we're there. And so, that's been really incredible. And just every time we get a chance to work on a grand opening. So I've worked on, over a dozen grand openings of buildings at Horizon.
Wow.
And it's just such a proud moment. We're opening, the wait list is getting less and less because we're opening these buildings, because we're having these ribbon cuttings.
Available.
Yes. So they're always just such proud moments where you just take a deep breath and take it all in, because we are serving a need, and we know someone's gonna walk through that door and get the help that they deserve.
Life-changing.
Yes.
And that is life-changing work that you are
doing. That's what we hope. Yeah, that's what we hope.
Now, stories. Kind of mentioned with the Painkillers Kill campaign, kind of build stories around with the people you work with.
Yes.
And you said you put kind of faces
yes
with this campaign. To me, that really, when you tell a story, it helps build that connection.
It totally does.
Because someone can relate to that story, and then they realize, oh, wow, maybe I do need support. Maybe I should go call Horizon.
Yes. So it's great that you bring that up, because over the last many years, I've had the opportunity to work with a lot of families. A lot of families who have unfortunately lost a loved one to mental health or substance use, or their loved one is in recovery. But these families have come together to raise funds, but more so raise awareness.
Right.
So we work with the Revelist Family Foundation, who puts on these events because, you know, Nick Revelist lost a close friend, Devin Waring, in high school to suicide.
Wow.
And so every year he called me starting in 2017, and he was like, I want to do something about mental health. And so we started a teen mental health program with the Revelist family, with the Devin Waring Foundation, Devin's family, and with the Good Climb, another family that was impacted by mental health. And we started this teen mental health program where we go into high schools, and we go into middle schools, and we go into colleges, and we talk about mental health, and we talk about research, and we talk about substance use. But I'm so grateful to work with all of these families because they're putting their loss, they're putting their struggles of what they've gone through to good.
Right.
And so they hold these golf outings, they hold these events, they hold these endurance challenges, and they really put it to incredible use. The Chris Maloney Legacy Foundation, Deb, who is Chris's mom, Chris was at Horizon Village. Unfortunately, he passed away. After he left, she puts on a golf outing every year and puts funds towards Horizon to take our residents out for golf, to teach them how to golf.
Oh, that's great.
And just this year, they raised enough money to put a putting green on our residential rehab campus in Sanborn in memory of Chris.
Wow, that's amazing.
And so these families are just constantly putting their loss and their struggles to good.
Right.
And we're so grateful to work with them.
And they're trusting you with their story.
Yes.
They're trusting you with their goal and mission of how they want to help too.
Yes.
Which is an amazing thing. Right?
It is. And a couple of years ago, we were grateful to work with the White family, and we have built Hillary's house out on our Sanborn campus. So Hillary struggled with substance use and unfortunately passed away. And her family came together and put funds towards Hillary's house. And it's a family program on our campus that we opened in 2023. And it's just this incredible building that our residents can go to. We have family programmings out there twice a week.
Oh, wow.
So
awesome.
People who are living out there, who are going through their treatment, they can invite their families and their kids and their loved ones, and we have holidays out there, and we have trunk or treat, and we have, sing-alongs and, lip sync battles. And but we focus a lot on family programming out there because it's not just an individual, struggle. It's the family as well.
It impacts everyone.
So the White family has been another family that's just been critical in getting those resources and information out to our community. So that's probably the best part of my job is unfortunately be connected to these families because of what they've gone through, but fortunately we can bring their thoughts and passion to life.
Yes.
And respect and honor their loved ones.
Yes.
And still continue to do good.
It's awesome. It helps them maybe keep they're living alive.
Yes.
In a way.
Yeah, the legacy. Yeah, absolutely.
The legacy. It's amazing. So you're talking about up in Sanborn.
Yes.
So not only is Horizon in Niagara County, obviously, but it's Erie County.
Yes, and Genesee County.
And Genesee County.
Yes.
Amazing. So it covers 3 counties in Western New York.
Yes,
that's great.
Yes.
We talked a lot about connection.
Yeah.
And connection is just so important for us as humans. Because connection goes beyond our day-to-day professional lives.
Totally.
So how else are you staying connected in the community?
Yes. And it's something I've been so passionate about my entire career.
Yeah.
And I always tell everybody, my one piece of advice is network. Sometimes it's hard.
Yeah.
Getting out of your comfort zone. I'll never forget the first networking event I went to when I first moved back. And I'm still friends with the first girl I met at that event.
I love that.
And I was so nervous and I didn't know anybody.
Yeah.
But networking is huge. And sometimes, you don't feel like it, or sometimes you're like, oh, I had a really long day. But to be intentional on, what events you're attending. And also, I'm still a huge proponent of joining a board.
Yeah.
If there's something you're passionate about, sit back, look at our community, and think about it. I'm currently on a few boards, and it's incredible. Some of them align with the mission of Horizon, and some of them are completely separate. Right. And I think that's great, too.
I think that's amazing. And you get some different ideas and perspectives.
Exactly.
Cross-collaboration.
Exactly.
Right? Like maybe you learn something on the Girls on the Run board that you bring back to Horizon.
100%. Yes. And, I also think in the world of remote work, so I'm a hybrid worker. Mm-hmm. I'm mostly in the office, but a lot of my friends are remote.
Yeah.
And so I always encourage them, join a board, join a committee. Like if you're not ready for a board, join a committee.
Yeah.
Because it gets you out there. It gets you networking. It gets you connected. It gets you thinking differently. And you never know what's going to come of it.
Never know.
What other opportunity, what other connection.
And you've built this beautiful career.
Thank you.
From joining the Horizon board.
Honestly. And I never thought that would happen.
Yeah.
I really didn't. I was excited to learn and join a board. I had never been on a board. Mm-hmm. I remember they handed me like a book on how to sit on a board, and I read it. And it was the best thing I ever did, because you're exactly right. I was able to, kind of grow my career and learn from these amazing leaders. And then also the committees I sat on, leading up to that, and then throughout my time at Horizon has been so helpful. It's added to my leadership. It's taught me, things that I should do, things that I shouldn't do. So the connection is so key in any aspect. If you're not ready to join a board, join a committee, you said earlier. And
or just attend an event, attend networking events.
Exactly. We have so many.
So many.
This city.
Anything you could be interested in, you could find an event to go to. And it doesn't have to be coined networking event.
It does not.
Like there's so many different ways. And I say to people all the time, like if you belong to a church,
yes,
network through your church, get to know people.
Absolutely.
If you're a parent, talk to your kids' friends' parents. Find out what they do, where they work. And just build that relationship around the people.
Absolutely.
If you go to the same restaurant or coffee shop, start talking to people that you see there on a regular basis.
Absolutely.
Get their story. I love to do that.
I love to do that too. And it's so funny you said that coffee shop, because I spoke at a training a couple months ago, and they were like, oh, what marketing advice do you have? And, about your career and about everything, communications. And I was like, I don't know if this is what you're looking for, but I was like, go and have coffee with somebody. Yeah. Go sit down and meet somebody and say, hey, let's meet for coffee. Yeah. And that's how you create that connection. You never know who they know, who you know. It could be a referral professionally. It could be something personally. But set up coffee once a quarter with someone.
Yeah, make that their goal. And that's easy.
It's
just once a quarter. It's not going to be weekly.
Exactly.
That's kind of little bite-sized bits. And it's going to continue to grow from there and grow your network.
Yes, it absolutely is. And I just think, especially in Buffalo and anywhere, not just Buffalo, but it's so nice to be connected. And everyone is just so thoughtful and intentional with those connections that you just never know where it's going to go.
You don't. And I always like to say, too, you don't have to network only when you're looking for a job.
Not at all.
You should always be building your network and building your relationships. Right. And it doesn't have to be you go and sit with someone and you want to ask for something. Right? It's just to get to know each other, get to know the work you do or the involvement you have in the community.
Right.
Just get to know someone's journey.
Yes.
And so much can come from that.
Absolutely.
And it can open doors you never even knew existed.
Exactly. Mm-hmm. You're exactly right. It's so worth it.
I remember when right around the time we were just starting StaffBuffalo, I actually was out to dinner with one of my girlfriends. We were sitting at the bar in a restaurant, and she asked the person next to her if she could try his wine. No, she didn't ask if she could try the wine. She asked what kind of wine he was drinking. She was trying to figure out what she wanted to drink.
Okay.
And turns out this person let her try his wine.
Which was very nice.
Turns out he owned a business. They turned into a StaffBuffalo client, and you're just that was not even a networking event.
Right.
That was not the intention at all of this interaction.
Not at all.
But we started talking with this person.
From it.
Snowballed.
Yep. Yes, that's so amazing.
It's amazing. And I never knew this company even existed in Western New York. And it's a big home health care company, and it was they do great work in the community as well. And we help them hire some key people for
That's
their team.
incredible.
So you just never know.
You don't. And that's the
Yeah.
thing. And I think to your point, like having those conversations, you never know where they're going to go.
Right.
And then cultivating it.
Yeah.
Cultivating it after the fact. If you get a business card, if you follow up, if you
Right.
set up that cup of
Connect on
coffee.
LinkedIn.
Yes, absolutely.
Right.
And then
you
just
use your fingertips too.
Yes.
It's easy. Like just
Exactly.
pull up LinkedIn, pull up a profile, send a message,
right.
write a quick note, ask them to join me for coffee at some point.
Yes.
Yeah.
So easy.
So easy. And I like to say, like, I'm an introverted extrovert. I like to think, I'm pretty extroverted, but at the same time, there's plenty of times I don't want to go to a networking event.
Yes.
I'm done. Or maybe I'm going and I'm going by myself. And I don't know anyone.
Right.
Yeah, who am I going to talk to?
Right.
It's just kind of like, you have to step in the room.
Exactly.
You got to be comfortable being uncomfortable.
You totally do.
That's where you grow. That's where you learn.
You're exactly
And you never know
right.
who you might meet.
Yes. And I feel like there has been so many times, exactly to your point, that like you don't feel like it. You've had a long week or
Yeah.
you've had a long day and you don't want to have another conversation. But then you go and you meet somebody, you exchange business cards, or you hear someone speak and it just resonates.
That is such a good point,
Right?
too. Mm-hmm.
And then you're like, gosh, I'm so happy I went. I'm so happy I heard that. And it
Yeah.
just sticks with you.
It sticks with you.
Yes.
And it can be life-changing.
Exactly.
You never know.
Exactly.
Yeah. Tell me more about like some of the boards that you're on currently.
Yes. So I just recently joined VIA, Visually Impaired Advancement Board, and they're incredible. And I had been volunteering for them for a long time. And so they were looking for board members. And so I just joined this year, and it's just an incredible organization in Western New York. We're so lucky to have them.
Oh, they're amazing.
I am on the Girls on the Run board. So I've been on the board for a couple years, but then I also coached.
Oh, fun.
Which is incredible because I'm not a runner. Unlike you, you're an amazing runner.
I transitioned a little bit more running and walking, but
I still admire your running. And I love that organization. They're an incredible organization for girls. And not only, you don't have to be a runner because I was a coach and I do not run unless I'm being chased. So, but you just learn so much about, growing, people in the community and building them up and showing kindness and empathy. Absolutely. And it just aligns so much with my values that I just love the organization so much. And then I'm on the Mental Health Advocates Board.
Oh,
so it's an incredible organization. Focuses so much on providing critical resources throughout the community around mental health, and we partner really, really well with them, and they partner with everybody, which is just so incredible. So they provide services that Horizon doesn't provide, and vice versa. So it's just this incredible relationship, and again, just another pillar of support in the Western New York community. So I feel very grateful.
A couple of things that have stuck out to me just in our conversations around the boards you're on and the work you've done at Horizon, and it's teaching people how to kind of build that mental resilience too, through running, through sports. And again, you don't have to run.
Right.
But it's putting the putting green in at the facility. And finding those little outlets that maybe can help you escape some of the stress you might be having.
Absolutely.
It helps so much. And sometimes I think people don't realize that, and especially as girls on the run, helping girls at such a young age develop confidence, develop different coping skills, and stress relief, and just getting outside and breathing fresh air.
Yes.
After school. Like, it just helps so much with mental health and wellness.
It does.
So it's not physical benefits necessarily. It's a lot of mental benefits that go so far.
You're exactly right. And I think teaching those pieces at such young ages and making sure you keep repeating that and you keep encouraging and showing support, like, the world's tough. And so to have these outlets and to teach these girls, and then it trickles down, right? To their friends, or they might come home and talk about it to their families and their loved ones, and then that might inspire somebody. So it's just that, domino effect that you hope when you instill something in somebody that it'll stick and, they'll remember it. Yeah. But to keep those conversations going. But you're right. It's not just the physical piece. It's that mental piece.
Right. And being just cheerleaders for others too.
Yes.
Helping, build camaraderie and cheer people on, that helps so much.
It does. And I feel like you and your team, and just like you and the community, like you're such a cheerleader for so many organizations and people.
About you.
And so it's contagious because the first time I met you, you're just a connector. Like, it's just natural. Yeah. And so And that feeds off. Like,
Absolutely.
I fed off on that. And I was like, oh my gosh, like, I want to make sure I'm doing that.
Do that because you do it so well. You're a bright light. You're so positive no matter what. You encourage people. Like,
and the world
and
needs
it's beyond the
that.
work you do professionally. It's who you are as a person, which I think just, like, you just bring this light to everything you do. And you encourage people, you support people. And it's a wonderful,
thank you.
wonderful attribute.
Thank you.
If someone's looking to get in touch with you, Chrissy, how can they get in touch with you?
So LinkedIn, for sure. I'm on LinkedIn.
Christina Pearl.
Yes, Christina Pearl on LinkedIn.
Yeah.
And then, honestly, email's great. You can email me at work. I'm on the Horizon website. It's cpearl@horizon-health.org. So, yes, I would love to connect. I'd love to have coffee.
Yeah.
So,
And if someone is looking for resources for their employees, their people in their life, their friends, their family, like, always can go to Horizon.
Absolutely. Yes. Horizon-health.org. And again, and thank you for bringing that up. We do a ton of community outreach. We have a ton of programs that we provide. So please reach out if you think it's something you need. We do, a ton of trainings. A lot of them are free, depending on some grants that we have. Yeah. But just any sort of connection or question somebody might need, we're here.
Awesome. Well, thank you so much for sharing your story. I know there's so many great tips throughout your story, just about navigating your career.
Yes.
The work you do in the community, building connections, and just being an advocate and a resource to others. It's amazing. So thank you so much. I know so many people of our listeners learned a lot.
Thank you. Thank you for having me.
Is there anything else that, our listeners of the podcast should know about Horizon or about you and your career we didn't touch on?
I think we touched on a lot. Yes. The only other thing I think I would say as far as like advice goes is always be comfortable asking for help, finding a mentor, utilizing either a mentor in your organization or somebody even outside your organization. Like, I think earlier in my career, I maybe wish I would have asked more questions or reached out to certain people a little bit more instead of trying to think I can do this on my own. And then later in life, you're like, oh yeah, I need help. I'm going to ask for all the help.
And people that are willing to help.
Yes, exactly. So utilize that mentorship. I was really lucky to have a lot of great women mentors in my career, both at Horizon and outside. So I think that would probably be the only other piece of advice.
I love it. Well, thank you so much.
Thank you.
And again, thank you for joining us. And thank you for listening to another episode of the Pain Points Podcast.
Thanks for tuning in to today's episode of the Pain Points Podcast. If you enjoyed what you heard, be sure to follow us so you never miss out on future episodes.